Living with type 1 diabetes means carrying a lot of responsibilities every day. All of the decisions, the numbers, the alarms, and the constant need to stay just at least one step ahead. And for the people around us, our parents, partners, family members, and caregivers, there's a different kind of weight. They want to help and understand, but don't always know what to do. My name is Scott Johnson, and today I'm joined by David Panzirer. David is the father of 2 adult children with type 1 diabetes, and that experience as a parent pushed him into action, advocating and driving real change in the T1D space. David is a trustee of the Helmsley Charitable Trust, where he directs significant investments in type 1 diabetes, including initiatives such as Blue Circle Health. You may not realize it, but David and the Helmsley Charitable Trust have likely played a role in the tools and therapies you use today. Before we continue, I need to remind you that we're not providing medical advice. For personalized guidance, we'll always encourage you to consult your healthcare team. Additionally, Blue Circle Health does not endorse any specific product brands and encourages you to discuss those details with your personal healthcare team. I'm excited to welcome David Panzirer to the show today. David, thank you so much for joining me. I'm really looking forward to this conversation.
Hey, Scott, thanks for having me. I'm looking forward to it as well.
Wonderful. Well, first of all, I don't want to assume that our listeners are familiar with you and the Helmsley Charitable Trust. Can you start by giving us a quick introduction and telling us what the Helmsley Charitable Trust is?
Sure. So the Helmsley Charitable Trust is a private foundation 100% focused on health and medical research. Started in 2007 upon the death of Leona Helmsley. Now a $7.5 billion entity, and type 1 diabetes is one of the major causes. It's actually the largest program of the trust, mainly because I'm a parent of 2 of my 3 children have type 1, and that's been kind of at least the driving force for starting it. I wouldn't say it's the driving force for things that we do.
Yeah. Well, I'd love to kind of focus in a little bit more on your experience as a parent. Start back at the beginning when your family first encountered type 1 diabetes. Can you share a little bit more about what that experience was like for you and your wife as parents?
Yeah, it was, so I knew March 23rd, 2007, I can tell you I knew absolutely nothing about type 1 diabetes until about 4:33 that afternoon when we got a call from our pediatrician. My wife had suspected something was wrong and dropped off a urine analysis for my pediatrician to do an analysis. Long story short, they called the next day and they're like, "We're really sorry to tell you this, but your daughter has type 1 diabetes. Prepare to go to the city tomorrow and spend the day." We were like, "What?" I knew absolutely nothing about diabetes. My wife knew a little bit because she's a nutritionist by training. And we had a 3-year-old and a 3-month-old in addition to Morgan, who was 6 at the time. So to say we were deer caught in headlights would probably be a huge understatement.
As you guys are rushing into the city, into the hospital and all that, tell me a little bit more about what you were feeling, what you were experiencing. What were you worried about at that point?
I mean, I didn't even know enough to be worried. I just knew enough that this was scary because it was unknown. So, I went on Dr. Google like everybody else, and I read all night, and I went in there with a lot of questions, not understanding anything. And I didn't fully understand that we were in for, a new life of literally finger pricks at that time and shots. CGM did not exist. And, we were sent home. I guess we were fortunate that my wife caught it early. So Morgan was not in DKA, but it was a Friday that we got sent into the city. We spent the day there and we were sent home. And I was like, oh my gosh, like we barely knew what to do. Went home that evening and we're like, I think we were on the phone with the on-call physician like 4 times that first night.
Yeah.
We're like, my hands are like this as I'm preparing to give Morgan a shot, and she's screaming and crying because she's 6 and doesn't understand it. And I'm like, oh my God, this is horrible. And it took a little while, but I would say after probably about 10, maybe it was a couple weeks, Morgan had shared a room with her younger sister, Caroline, who has since been diagnosed with type 1 as well. But she was sharing a room. We took her out. We brought her into the bathroom, and I was like, Morgan, I kneeled down in front of her because she was screaming, crying, and I'm looking at my hand, and my hand is shaking with the pen in it. Morgan, we really have to do this, or I have to bring you to the hospital.
Yeah.
And she looked me dead in the eye. It was probably a month into it, and she said, "Give it to me. I'm doing." And I'm like, "What?" And it took her 45 minutes of screaming, crying, and all that stuff. But she gave herself a shot in the stomach. And I'd say from that point on, she picked up my wife and I, put us on her back, and said, "I'm done with this nonsense. We're moving forward." Wow. And I think in some respects, all of the Panzerers were all a little bit of control freaks. And I'm pretty sure this was Morgan's way of grabbing a little bit of control and saying, "I'm going to do this." And she really hasn't looked back since. She's now 25 and been living with this disease 19 years.
Yeah. Well. It's such a great story of bravery. And, it always strikes me that we so easily compartmentalize all the medical aspects and the tasks, right? Like poking our fingers and giving shots and things like that. But there's really nothing normal about it. And it takes immense bravery to do that. We're going to lean more into some of those stories and learn more about what you were feeling and experiencing. But I want to bring people through how that brought you into your advocacy. So at some point, all of that personal experience started pulling you deeper into advocacy, really leading to real change for many of us with T1D. But at that point in time, you didn't have anything to do with diabetes or advocacy. Yep. Can you take us through the process of that transformation for you?
Yeah. So literally Morgan was diagnosed in March of 2007. 5 months later, I became a trustee of the trust. I barely knew how to care for my daughter, let alone understand how to deploy the amount of resources that we had. So I started traveling and learning, and fear is a very good motivator. Yeah. And I was scared. I literally was scared. And I made a very simple promise to Morgan at 6 years old, and that was that I would help her in any way that I can. So here I was, these two events happening 5 months apart, except I had no clue. So I started traveling and learning, and here I am now, it's 18 years later, and I'm now amassed almost 1 million miles on United, and I'm still traveling and learning, but I have a pretty good feel for the ecosystem. I have a really good team that we've built here at the Trust. So I have 19 folks here that do nothing but diabetes, everybody from I have PhD scientists, I have an engineer, I have folks with their masters in public health, because I needed people to help me dissect and interpret what science was telling me, which I had zero clue on how to do. So the one thing I will take credit for is hiring really smart people and getting out of the way. And, I've got a very excellent team here that does unbelievable work and is just about as passionate as I am about it, even though they don't have the personal impact that I do in my family. So it's been an amazing group of people to work with.
Yeah, that's very clear in everything that comes through. You mentioned seeing and experiencing a lot of the diabetes ecosystem. So from research to technology to care models. From where you sit, why has it been important for you to step into that advocate role and get a finger on the pulse of all those different ecosystems when you really just wanted to be a parent?
Well, I did just want to be a parent, but and it took me a while to understand not only the opportunity I had in front of me, but the responsibility to lean in. And I didn't fully understand that at first. It took me some time to realize that. But at the end of the day, we have a very broken healthcare system here in the U.S. I would actually argue there's absolutely nothing redeemable about it. It is horrible. If you were trying to design a system that would make life really difficult for people with a chronic disease, you'd have exactly what we have here in the U.S. So there was that piece of it. Then there was, as I learned and traveled around, you really saw the disparities between those who were seen by an endocrinologist and those who were not. And that really correlates to geography, because most diabetes centers are associated with larger urban areas or larger academic centers, which means if you live by and large in the middle of the country, you don't have access. And when I began to see some of those disparities and my team traveling around seeing them, it became pretty clear that something had to change. And when we first started, I don't know what the statistics are up to now, but less than 35% of people were hitting their ADA recommended targets for glucose management. And that to me is pretty abysmal. So I kind of felt like we had to do better.
How would you say your advocacy has changed over the years as you've learned and experienced many different things?
I would say, in a nutshell, I started out like every other parent, right? I was like, I want a cure for my child, without understanding how incredibly naive that was. That was my mindset. And, my mindset was, well, JDRF at the time, now Breakthrough, they've been around since 1976-ish, and they must be doing something wrong because this should be solved. And of course, that's not fair. It's incredibly naive, and I had no clue what I was talking about. But that was my mindset. As I began to learn and travel and see things, and then, I really became kind of this voice of the under-resourced or underserved, or bringing those, I've learned that over the years in our community, and I think this is like this in a lot of disease communities, we are very in tune to the vocal minority, which is not really, the majority of folks living with this disease. So we started traveling around and learning and doing these focus groups on, for instance, when we were doing diligence on how to impact people from lower socioeconomic status areas, we went and talked to them. And I was blown away because I just thought they needed access to the same tools that we had. And until you go and talk and understand their lived experience, you recognize, or at least I did, that diabetes in a lot of cases is their least of their problems. And, they've got all sorts of issues. And it became very clear to me that voice was never, ever at the table. And I felt a very strong sense of obligation to bring that voice to the table. And I think that continues to be our role today. We try and bring and make sure that the voice of everybody is at the table. And it's incredibly hard to do. But I don't know. I feel like that's my calling.
At the center of all this is really your own family's experience. And because of your role today, that's not something we hear enough about, right? Where there's always a focus on what you're doing with Helmsley Charitable Trust, which is also important too. But I'd love to spend a few more minutes just talking more about you and your family and your experience. Was there a moment when you realized just how much responsibility your kids would eventually have to take on themselves? And what was that like for you and Karen?
Oh, yeah. I mean, I think Karen had a little bit more of a clue than I did. But recognizing that insulin is a hormone, that allows you to metabolize carbs. And if you get it really wrong, you can get yourself in big trouble pretty quick. And that always made me really nervous. What I think changed, and I'm a worrier to begin with, like I worry about a lot. And I think what really changed things for me was the follow app in Dexcom. Because it went from waking up in the middle of the night 2 to 3 times a night, digging Morgan's hands out, pricking her finger, hoping I don't wake her up. If she's low, shoving a juice box straw in her mouth and telling her to drink. And, it was every single night. And then, being able to roll over and look at the CGM on my phone. And, even when Morgan was in college, being able to know she's at least safe. Morgan would tell you, and Caroline would also tell you, they needed to come up with rules of engagement as to when I was allowed to reach out to them. Because at the beginning, I'm a perfectionist, so diabetes is a really bad disease for me to be involved with. So at the beginning, I'd be reaching out to Morgan or Caroline and be like, "Oh, you're high or you're low," and I would get some obnoxious text back like "duh," or Morgan used to love to say, "Thanks, Captain Obvious. What else you got?" Stuff like that. And eventually, after a couple of weeks, Morgan came home and she's like, "Dad, we need to talk because you're driving me nuts." And I said, "Okay." So very long story short, we came up with rules of engagement. So when I'm allowed to reach out, something, if you're high for 3 or more hours and I don't see it reversing, if you're below a certain number and I don't see it flattening out or starting to go up after 20 minutes, you're going to hear from me. And if you're super low, you're going to hear from me right away. And we came up with those kind of rules of engagement, as we called it. And I would say that probably saved my relationship with my daughters, because all I wanted to do was make sure they were safe. But I was a bit of a helicopter parent. So I'm sure that, and my wife told me that. She gave me the greatest piece of advice that I probably ever have in my life. My wife gave to me, I don't know, Morgan was probably 10 or 12 or something like that. And she said, look, at the end of the day, this is her disease and Caroline's disease. They're going to leave our home and they're going to make a decision to engage or not. But if you keep harassing them and keep being a pain in their butt, they're going to resent you and resent the disease. And that really hit home for me. So, I backed off a lot, especially for me. Morgan and Caroline would probably say not so much, but it felt like I did. Having the data on my phone so that I can make sure they're safe and recognizing that, if there's not an imminent danger from a severe low or a really severe high going on for a while, I could back off, right? The highs and the lows are part of diabetes management. It took me a really long time to accept that. My fear was I wanted to mimic normal blood sugars as much as possible. What I did, though, was allow that to kind of strain my relationship with my children.
That's a natural thing, right? As parents, we worry about our children. I'll never forget when similar experience, when the Dexcom Follow first hit the scene, and at that point, my mom had already passed, so my dad was really, I was an adult. My dad was excited to have this opportunity to have access to my blood sugars, but after a couple of weeks, he shared that it was completely overwhelming to him because he had come up in a world where we were checking my blood sugar maybe 6 to 8 times a day, which in those days, that was a lot to do even then, right? But all of a sudden, he's got access to hundreds and hundreds of data points, and it really overwhelmed him. And I find that really, really striking. But parents are always going to worry. I'm always going to worry about my kids, but I love that you and Morgan and Caroline were able to sort of find a balancing point there.
Yeah, thankfully, my kids didn't banish me and kick me off of Share. Once we came up with the rules, they let me stay on board as long as I played by the rules. So it's been good.
Living with type 1 diabetes often teaches people a lot about themselves over time. And as you've watched your kids grow up with this condition, what are some things that maybe they've taught you?
Yeah, so I've said this so many different times, but when Morgan was first diagnosed, I had a 6-year-old, because Morgan was 6 at the time, who was my teacher in life. And she taught me about resilience. She taught me how to persevere, leadership, bravery, courage. After a few weeks, she was like, I'm done with this crap. I'm going on. Caroline, when she was diagnosed, she had a great role model in Morgan. Caroline was playing lacrosse at a high school level, or that might have been junior high school. She's now a D1 lacrosse player, doing really well, and has learned, through a lot of trial and error, how to manage her disease. And it's perseverance. It's, I'm not going to let this disease define who and what I can do. And I think that's an incredibly powerful message. And I can honestly say that having my children with a chronic disease has made me a better person. I'd cut my right arm off to take it away from them, but there's no doubt that watching these kids and now adults do what they do has absolutely inspired me and taught me so many different life lessons. It also taught me perspective, right? What's really important in life? Like, we probably, like every other set of parents, worried about, in hindsight, what was incredibly trivial, stupid stuff. And then you deal with a disease like this, or God forbid, something worse. you get your perspective adjusted pretty darn fast. And we were no different.
As you started hearing more and more stories from people living with type 1 diabetes, is there anything that maybe surprised you about their day-to-day experience?
Yeah, I mean, honestly, I didn't know anything about healthcare until my kids got diagnosed, and you get a quick lesson or 10 really quickly. And I came to realize, even with having decent insurance, it's a battle. And I had no idea how broken the healthcare system is, and how, if you look at the large majority of healthcare, the goal is to treat symptoms, do so as cheaply as possible, and they don't solve anything.
When you hear about some of these challenges from people living with diabetes, how does that shape the way you think about where energy and resources should go to try and make things better?
As I said, I have a team of 19 folks, and our job at the end of the day is understand the ecosystem, because you cannot have an impact unless you understand what the players are doing. So, we have folks that keep up on the science. We have folks that keep up with the regulators. I spend a lot of time with industry, so those companies playing in this field, so that I can understand what's in their pipeline. More importantly, what's falling out of their pipeline, and is there things that we may be able to advance to kind of be the tide to raise all boats. So there's definitely that piece of understand the ecosystem, so that you know what levers are available for you to pull to change things. And I hate to say it, Scott, but there's so much incredibly low-hanging fruit that, there's so many things that I would change if I were king of the world. I would start with an insurance company that actually cares about people, and value-based healthcare, and, all of that kind of personalized medicine. Those are buzzwords. That's not real. And, I would love to see that be real here in the United States, that you actually get rewarded for taking care of people instead of trying to save a buck for the bottom line while people suffer. And that's what we have today, unfortunately.
Yeah. How did all of this lead to the formation of Blue Circle Health? And where does that fit into the bigger picture of Helmsley's grant portfolio?
Yeah. So Blue Circle Health really started with an idea that I had in 2017. And you'll laugh at this. I don't know if I've told you this story, Scott, but I wanted to create the Geek Squad for type 1 diabetes. And I even went so far as I reached out to the founder of Best Buy, Dick Schultz. I wrote him a letter, literally a handwritten letter, and I sent it to his foundation. And the head of his foundation sent me an email back saying, please send me, a brief email as to why Dick Schultz should take your call. So I wrote a brief email. Bullet number 1 was, I don't want your money. Bullet number 2 was, I just want 10 minutes of your time to talk to you about a Geek Squad idea for type 1 diabetes. Little did I know, Dick Schultz has a daughter with type 1. And I had met her. And I didn't even put 2 and 2 together because she was under a married name. So it never occurred to me. But he said to me back in 2017, so understanding, right, this is pre-COVID, he said to me, listen to my idea. He said, David, you're not going to need boots on the ground the way we do the Geek Squad, because you're going to be able to do almost all of this virtually. So I started thinking to myself, and by the way, it wasn't just me. I got together a group of KOLs together. My team had a lot of input on, could we create a virtual specialty clinic? So if you live in rural America, you would have the same access to the same care that I can receive here in New York City, or pick your any other major clinic. And that was really the beginning of Blue Circle Health. We had funded a project called Project Echo out of New Mexico. They were doing part of it at the University of Florida in Gainesville. So we decided to use that infrastructure of those folks who were already working in Florida, and decided Florida was going to be our first state to do Blue Circle Health in. Turned out that was probably a really crappy decision, because Florida is incredibly difficult to work with. But if you could do it in Florida, you could do it almost anywhere. So that was really the beginning of Blue Circle Health. And there's been a lot of people now, including yourself, who now work at Blue Circle, that are having input and expertise in helping to shape how we move forward.
Well, and I think, you have shaped the way that that the team has come together, and also the fact that listening is really one of the core things that we do. We don't assume that we know the best way to do things, and it's also different in every place that we go. And so listening is a big key. All right, this is a great place to take a quick break. And when we come back, I want to talk about what parents, partners, and allies can do to better support the people in their lives who are living with type 1 diabetes. We'll be right back. One of our favorite things is sharing stories from people who've participated in the program. And I have one here from Lindsay in Florida, who's been living with type 1 diabetes since 1989.
My name is Lindsay Teeter, and I have been diabetic for most of my life. I was diagnosed in 1989. Going to the gym, that was always my struggle. All I wanted to do was go in there and kick some bags, and then I couldn't. Or even starting the workout and being a few minutes in and then having to stop and go sit down somewhere and drink a juice or Skittles or whatever I had on me while I just watched other people work out. It made me a little bitter. I wouldn't pick back up and go work out because I was just, I don't know, felt defeated at that point. Doctor-wise, I had one great endocrinologist, but she ended up moving to Texas. And I've never really had another endocrinologist that I felt comfortable with. I don't think they're giving me bad information, but it's just a doctor's appointment, Go and do what you need to do, go over some numbers, get a lecture because their numbers aren't great, and move on. Then when I joined Blue Circle and would talk to people who were like, all right, so your numbers, and I would be ready. Like, okay, I'm ready. Yell at me. I know it got high yesterday at this time, but it's because of this. And they were always so understanding. And they were like, but even the rest of the day, how amazing this was. You're killing it. And they always were so positive. There was never any negative. I never had anything negative said to me. And that meant a lot. I'm a lot better about looking at my reports to see if I'm noticing any trends to try and troubleshoot if I can. And I definitely never did that before. I never trusted myself to, but I'll make a little adjustments here and there. That's not something I ever had the confidence to do before that they gave me. So yeah, I think that for sure, just paying more attention and being confident in myself to make changes. I put it off for a long time and I should have started sooner because it really was life-changing for me for the better.
Thank you, Lindsay. We really appreciate you sharing your story with us today. Now, before we dive back in, I want to share something I found really helpful. And again, this isn't an ad or anything like that. It's just a resource that I think is worth knowing about. There's a community called Children with Diabetes that's been bringing families together around type 1 diabetes for a very long time. They're probably best known for their Friends for Life conferences, where people living with T1D and their families come together to learn from each other, share experiences, and build real connections. And honestly, it's one of the places where that kind of listening that we've been talking about today really comes to life, where parents, kids, and adults, and grandparents, and the whole support system with T1D are all learning from each other, not just from experts, but also from real lived experience. If you've never checked it out, it's definitely worth exploring. Learn more at childrenwithdiabetes.com. And honestly, it's a great example of what support can actually look like in real life, which is exactly what I want to dig into next. All right, welcome back. We've been talking about your experience as a parent and what you've learned from listening across the type 1 diabetes community, but I'd love to spend the rest of our time together talking about what some of those lessons might mean for the people around us, the parents and partners and others who want to support someone living with type 1 diabetes. And let's start with parents who maybe are still relatively new to type 1 diabetes. What's something you wish someone had told you earlier in your journey?
No one blood sugar, if it's not too high or too low, is going to hurt, right? You're going to have crappy days. You're going to have better days. And it's just part of the deal, right? And I really struggled with handling the volatility because I really wanted things to be as quote unquote normal as possible. So I would say, allow yourself some grace. allow, your child some grace who may be dealing with this. And, job one as a parent is keep your kids safe. And at the end of the day, allowing them to own as much of the disease management as possible at any age. Because Morgan really started like 3 weeks or a month in, and we were just like, wow. And we let her do it. And then she wanted to program her own pump when she got her pump. We let her do it. Obviously, we watched, we supervised, but we let her grab as much ownership as possible. And as I said earlier, my wife's advice to me of backing off and letting Morgan own it was really, really great advice, because it is her disease and she is going to leave. And, I'm not always going to be there to, be the safety net. I hope I will, but, odds are I probably won't. So I'd say being able to back off a little and allow them to kind of spread their wings and own it, I wish somebody would have told me that. I'm not sure I would have been capable of doing it, but I wish somebody would have told me that.
Yeah, well, it's really hard too, because I think about the kind of the fire drill of learning the things we can manage in type 1 diabetes, right? You go through this fire drill of learning all of this very, very quickly. And it's very overwhelming. But I think that for a long time growing up, often came out of my doctor's appointments with pretty unrealistic expectations that if I do what they say, I will see results that match what I'm expecting. And we all know that type 1 diabetes just doesn't work quite like that. A lot of people living with type 1 diabetes, they have parents, partners, family members who they want to help, but they really aren't sure what helpful support actually looks like. From your perspective, what does good support look like?
So, it's funny because we've talked to so many people over the years, and honestly, there was somebody, a set of parents that we were introduced to when Morgan was first diagnosed, that was so incredibly helpful. And I would say the one thing that we've really struggled with is you really don't understand the mental burden or the constant worry or the grind unless you live it. And I don't know how to make that more tangible or more real, but I would say, as with today's tools, right? We used to, when my wife and I finally went out to our first dinner, which was probably 2 years after Morgan was diagnosed, I remember we would call in like every half hour or an hour just to see what's going on. And by the way, there wasn't really a lot of cell phones back then either. So we'd be at a restaurant and the whole conversation would be about, who's watching our daughter? Do they know what to do? You teach them how to use glucagon, and sure, but it was really nerve-wracking. So I would say try and get professionally educated. There are a lot of clinics now that do online classes for parents and caregivers. And I think to the extent that people can really just dig in a little bit, so you can give folks, who can now leave their child with a caregiver. And honestly, the Dexcom share gives you really peace of mind that enables things to happen. But, for us, we really struggled because people wanted to help, but we didn't even know how to help them, right? We were deer in headlights ourselves. Like, we didn't know what to tell them. So I'd say education is probably the biggest one. At least understand what to do, how insulin works, and what to do in an emergency.
You shared earlier how your advocacy has changed over time. And, something I want to touch on before we start to wrap things up here is that not everyone has the ability to advocate on such a large scale. And for people who simply want to make life a little easier for someone living with diabetes, where do you think they can start?
Yeah, so look, I've been afforded an amazing platform at which to, advocate from and actually have an impact on people's lives. And I don't take that lightly. But there are vehicles to be able to use that anybody can lean into. So pick your public charity. Breakthrough T1D has a big advocacy arm. ADA, I think, is a little more state by state, where Breakthrough is more federal. You've got awareness campaigns that Beyond Type 1 and many others do. So just lean into a local chapter there or a different organization. Contact your congressman. make a call. Say, look, this is not okay. Advocate and teach your children how to advocate for what they need. Because in healthcare, the squeaky wheel gets the oil. And I hate to say that, but it's true. So you often have to be persistent and continually ask for what you need to get around some of the quote unquote speed bumps that are in our healthcare system. And if you persevere, you can get what you need. It takes time. It takes energy. It's incredibly frustrating, but it can absolutely be done at any level.
Very well said. As we wrap up here, what is your hope for the next 5, 10, 15 years in the T1D space?
I have quite a few, Scott, but I'll start with, I really would hope to see further advancements in some of the things that we've done. So look, there are great tools now where I would argue nobody should be walking around with a double-digit A1C anymore, right? If you use the automated insulin delivery systems, you change it out and pay just a little bit of attention, you should be able to get down to an 8.5 almost with your eyes closed. And I don't mean to belittle it, but it has gotten that good. From there, I would love to see the disparities between the haves and the have-nots narrow quite a bit. And lastly, I'd love to see folks lean into helping to support Blue Circle Health. Right now it's pretty much 100% supported by Helmsley, and we did that by design. Blue Circle is now, I believe, in 20 states. I should know this. You're
nope,
not.
That's it. Yep, 20 states.
Thank you, Scott. So we're trying to get as widespread as possible, but we also are limited to a budget. And money, unfortunately, is the gating factor. So at some point, Blue Circle will begin a campaign to raise money. For now, it's supported by Helmsley. And, we understand at the end of the day, it's a long haul to change healthcare. Helmsley is committed to the long haul. We can't do it by ourselves, though, if we're going to go nationwide. There are too many competing priorities. So I would say that, and I would say no matter what your area of means is, there's always a way to give back. And it could be just supporting somebody. It could be simple as that. But there's always a way to give back. And we were extremely grateful for folks who helped us early on. And we vowed to pay that forward 100-fold. And thankfully, we've been able to do that.
Yeah, very well said again, David. And the mission is to be available for every adult living with type 1 diabetes in America. So we're working on it, and we're working to get to where you are out there, listener, who needs help. So, David, thank you so much for talking with us today. We really, really appreciate it, and thank you so much for your time.
Hey, Scott, it was my pleasure. I appreciate you having me on.
Thanks for listening today. If you found this conversation helpful, consider sharing it with someone in your life who supports you in your diabetes journey, or someone who wants to just understand a little better what it's like to live with type 1 diabetes. And then please be sure to tune in for our next episode. Until then, keep living well with T1D.